Novitas Solutions and First Coast Service Options On-Demand Education Series presents Critical Access Hospitals Method 2 Professional Reassignments. This on-demand tutorial is a general summary that explains certain aspects of the Medicare program, but it is not a legal document. The official Medicare program provisions are contained in the relevant laws, regulations, and rulings. Medicare policy changes frequently. Links to the source documents have been provided for your reference. This on-demand tutorial was prepared as a tool to assist providers, and it is not intended to grant rights or impose obligations. Method 2 Professional Reassignments. Medicare Critical Access Hospitals, which bill under Method 2 for both the professional and facility services, by having the physician professionals reassign Medicare billing rights to the hospital. Physician professionals report reassignments under the Critical Access Hospital NPI CMS 6-digit CCN number to that Medicare Administrative Contractor, your MAC, via the Provider Enrollment Chain and Ownership System known as PACOS, or the paper CMS 855I prior to the submission of claims. Failure to report reassignments will result in Medicare claims RTPing when the combined claim contains professional services under the Critical Access Method 2 billing starting January the 2nd, 2026. Claims RTP for this reason will be returned using reason codes 31006 and or 31007. However, it's came to the attention that many physician professionals have failed to report reassignments in PACOS, resulting in Medicare claim RTPs with reason codes 31006 and or 31007. CMS has delayed deployment of the Critical Access Method 2 claims editing until January the 2nd, 2026. This allows our physicians, professionals time to report reassignments under the Critical Access NPI CCN number via PACOS or the paper CMS 855I. Background for this change. Change request 13900, editing for duplicate processing for practitioner professional services and critical access professional services, was implemented on July the 7th, 2025, to ensure the reassignment information for physicians and or professionals was on file with the Medicare in the PACOS system when Critical Access Method 2 claims for professional services were submitted. CMS has issued new instructions implementing the FIS reason codes 31006 for our rendering physician NPI data, if present on the claim, does not match the PACOS call reassignment file, and or 31007, this is your attending physician NPI on the claim, does not match the PACOS Critical Access Hospital reassignment file. For call Method 2 claims involving professional services with revenue codes associated is 96X, 97X, and or 98X. This change is crucial for ensuring proper documentation and adherence to the updated guidelines. This editing deployment does not change previous Medicare requirements. However, it is not validating the existence of the reassignment relationships prior to conserving Medicare reimbursement. Call Method 2, Physician and/or Professional Reassignments. Calls that choose the optional payment method, also known as Call Method 2, instead of the standard payment method as Call Method 1, per Section 1834 G2 of the Social Security Act. The Critical Access Method 2 bills for both facility and professional outpatient services, that's combined billing, on the UB04 when the physician or professionals have reassigned their billing rights to the Critical Access Method 2. For providers that elect the optional payment method, a Call Method 2, or the physician professional must submit the reassignment application online via PACOS or the paper form CMS 855I. The Critical Access Method 2 will maintain a copy of the form for its own record. Physicians and/or professionals reassign benefits directly to the Critical Access Hospital's CCN Part A enrollment. CMS will RTP our Call Method 2 claims for the physician or professional services if a reassignment is not on file with the Medicare and the PACOS prior to the claim submission. Call Method 2 providers are encouraged to take this opportunity to review enrollment records in PACOS and submit the physician or professional reassignment applications if necessary. Remember, you have to reassign for outpatient services on a Method 2 on the Critical Access Hospital NPI CCN. Physician professionals that have reassigned benefits to the Call Method 2 log into the PACOS to ensure the reassignment information is accurate. Medicare will validate physician or professional reassignments to make sure the claim data matches PACOS data prior to claim reimbursement. If any critical access or physicians and professionals are experiencing issues with enrollments related to the 855A or the 855I, please contact the Novitas Enrollment Department for assistance. JH Providers 1-855-252-8782, option 4. JL Providers 1-877-235-8073, option 4. And my JN Providers 1-888-845-8614. Claim submission. Beginning January the 2nd, 2026, dates of service on or after July the 1st of 2025, reason code 31006 and or 31007 will assign on Critical Access Hospital Method 2 claims, type of bill 85X, claim lines for any professional services with revenue codes 096X, 097X, and or 098X when one of the following apply. The line item rendering professional NPI does not have a reassignment on file in PACOS, or the line item data service on the claim does not fall within that professional's effective and term dates, if applicable, in PACOS. If there is no line item rendering professional NPI, the claim level rendering professional NPI does not have a reassignment on file in PACOS, or the claim level from and through dates on the claim do not fall within that professional's effective and term dates, again, if applicable, in PACOS. Or if there is no line item or claim level rendering professional NPI, the claim level attending professional NPI does not have a reassignment on file in PACOS, or the claim level from and through dates on the claim do not fall within the professional's effective and term dates, if applicable, in PACOS. Provider actions to resolve RTP claims. CMS will activate the RTP reason code 31006 and 31007 to validate the provider professional reassignment to a Method 2 critical access hospital effective January 2nd, 2026. When reason codes 31006 and 31007 are assigned, critical access hospital Method 2 providers must take the following actions to resolve these edits. The critical access hospital Method 2 provider must ensure that all eligible healthcare physician professionals who reassign their benefits to the critical access hospital Method 2 are correctly reported to Medicare in PACOS. To establish the reassignment between the critical access hospital Method 2 and the physician professional, submit via PACOS or the CMS 855I application. The reassignment must be assigned to the critical access hospital's Part A enrollment and not the clinic's enrollment. This will be under the Part A Critical Access Hospital NPI CCN number. The reassignment can be established through the individual's enrollment record. The NPI and the CMS certification number, that's your 6-digit CCN, of the critical access hospital Method 2 must be reported on the reassignment application. Enrollment update submission deadlines. Critical access hospital Method 2 providers are encouraged to submit these reassignments promptly for processing to avoid receiving claim RTPs beginning January 2nd, 2026. Depending on the type of application and if additional information is necessary for processing, MACs have 15 to 100 calendar days to process enrollment applications. How to reassign benefits. Practitioners rendering services at a Method 2 critical access hospital may elect to reassign billing rights to the critical access hospital. Under this election, a critical access hospital will receive payment from the Part A MAC for professional services furnished in the outpatient department. Reassigning benefits requires all outpatient charges billed on the UB04 claim form. No charges would be billed by the provider on the CMS 1500 claim form. Reassigning a practitioner's benefit for the critical access hospital NPI CCN for the outpatient services. The practitioner can also reassign benefits for the group clinic as well for their inpatient professional fees billing. Two separate reassignments are submitted. Reassignment, enrolling via paper CMS 855I. Let's review how we should be filling this out for the appropriate information in order to reassign correctly. Critical access hospitals, method 2 providers and professionals submitting reassignments via paper CMS 855I. Under the 855I form, section 4F, individual, organizational, group receiving the reassigned benefits, you're going to furnish the requested information about each organization to which the benefits would be reassigned. This section fully replaces the Medicare enrollment application reassignment of the 855R. The reassignment of Medicare benefits, the 855R application, was terminated. Section 4F2, organization, group receiving reassigned benefits identification. If the reassignment is to the organization, please supply the information in this section. If the initial enrollment application is not complete and a CMS certification number, that's your CCN 6-digit number, has not been issued, please write pending in the Medicare identification number field. Reassignment, enrolling via PACOS Web. If submitting the reassignment via PACOS Web, enter the information in the reassignment topic. If the provider reassigning to the critical access hospital exists in PACOS in the state the call is located, the submission can be completed through the call enrollment or the individual's enrollment via the reassignment topic. If the individual is not currently enrolled in the state the call is located, then submit via the individual application to the Part B MAC. Let's review existing provider reassignment submitted via the call enrollment. User will find the existing call enrollment under My Enrollments. Select View, Manage Reassignments. Select Manage Reassignments. Answer the application questionnaire regarding if other updates on the enrollment are only updates to the reassignment. Select Next Page. Start application. Select the reassignment topic. Select Add Information. Complete all required information for Accept Reassignment. Select Next Page. Provide the CCN of the critical access hospital. Select Next Page. Practice location address. This is optional. Then select Save. Now let's review submitting via the individual's enrollment. From the Submitted Application topic view, select Reassignments. Select Add Information. The Reassignment of Benefits questionnaire will populate, asking the reassignment relationship. If the Medicare applicant is reassigning benefits to another Medicare provider or accepting benefits from another Medicare provider, the applicant will select the first option to reassign benefits to the critical access hospital. Click Next Page after making selection. The next questionnaire will ask if the applicant's benefits will be assigned to the individual or organization. User will select Organization if reassigning to the call. Click Next Page after making selection. Enter the group, organization receiving benefits information, clicking Next Page, after completing the required data. Provide the CCN of the critical access hospital. Next page. Practice location address, optional, then select Save. Call Method 2. Who can reassign benefits? Practitioners rendering services at a Method 2 call may elect to reassign their benefits to the call. Not all practitioners have to reassign benefits for the hospital to be a Method 2 call. Practitioner types eligible to reassign benefits to the call are Doctor of Medicine or Osteopathy, Dental Surgery, Pediatric Medicine, Optometry, Chiropractic Medicine, Certified Clinical Nurse Specialist, Nurse Practitioner, Clinical Psychologist, Certified Nurse Midwife, Licensed Clinical Social Worker, Certified Registered Nurse Anesthetist, Registered Dietitian Nutritional Professional, Physician Assistant, Marriage and Family Therapist, and Mental Health Counselors. Method 2, Practitioner Attestation. For each of our physician practitioners who agree to be included under the optional payment method, Method 2, reassign benefits accordingly. Practitioners choosing to reassign benefits to the hospital must sign attestation. States that practitioner will not bill Part B for any services provided to hospital outpatients. Physicians, non-physician practitioners will look to the critical access hospital for payment of professional services. Attestation remains on file at the critical access hospital. There are no standard forms. The critical access will need to create the attestation and keep that on file. Let's review the importance of benefits assigned to the call. Reassignment applications. Providers must ensure all eligible healthcare professionals who reassign their benefits to the call are correctly reported in the PACOS. This requires a paper CMS 855I or PACOS Web for the Critical Access Hospital Part A. If the provider reassigns benefits for inpatient professional services, a separate paper CMS 855I or PACOS Web is required for the Part B group clinic. They cannot be submitted on the same paper CMS 855I or PACOS Web. To add the reassignment to the call's enrollment record, submit the application using the Part A Medicare identification number of the call hospital, not the clinic's enrollment. This identification number is the NPI and the CCN of the call's enrollment record. To add the reassignment to the call's group clinic enrollment record, submit the application using the Part B Medicare Group Clinics enrollment. This identification number is the NPI and the PTAN from the call's group clinic enrollment record. Calls are encouraged to submit these applications promptly so that Novitas and First Coast can process them before the RTP reason codes are reactivated on January the 2nd, 2026. Following resources provide additional detail regarding the information reviewed in this video. We do have 3 slides that includes all of the information that we have discussed in today's video. Thank you for watching. We encourage you to visit our websites to access additional on-demand resources or participate in our educational events. Visit our learning centers to access the most current Medicare education.